Hey everyone, this is Ben with RegisteredNurseRN.com, and in this video I'm going to talk about physical therapist assistants, also known as PTAs. And I'm going to go through the job overview, the education requirements, some of the likes and the dislikes of this profession, and then I'm going to go through some detailed salary statistics so you can know exactly how much money these individuals make on average. Now, I've already completed a video on physical therapists, so if you're interested in learning more about that, you may want to check out our YouTube channel and search for that and watch that video. So what does a PTA do on the job? Well, what these individuals do is they will work under the direction and supervision of physical therapists. And this is a very hands-on job. They will work directly with patients and help them recover from illnesses or injuries, and they will help them minimize their pain, learn to walk again, and so forth. So what are some of the duties that a PTA will do on the job? Well, first of all, they will observe patients before, during, and after treatments and report everything to the physical therapist. They will also help patients do specific exercises as a part of their care plan. They will also use a variety of techniques. They will use massages, exercises. They will also use electrical stimulation and a lot of other therapies to help that patient regain their quality of life and minimize their pain and so forth. They will also use a lot of devices. They may use, for example, they may use a walker and teach a patient how to use that walker and help them do that. And of course, they'll talk to the family members or friends and the patient themselves and educate them on what to do once the therapy is over and how they should manage certain things in their life and so forth. Now, what about the education requirements? Well, if you want to become a physical therapy assistant, generally it takes a 2-year degree, an associate's degree, and within that time you'll have to do clinical work. And then once you graduate and meet all the education requirements, you have to go to an accredited school, usually a technical school or college. And then once you graduate, you will have to sit for a state licensing exam that is administered by the Federation of State Boards of Physical Therapy. And once you pass that exam, you will be able to practice and work under a physical therapist. Now, let's talk about some of the likes and the dislikes of this profession, because every profession has its pros and cons, right? Well, one of the likes is that a lot of physical therapist assistants feel that it's a very rewarding job because they know that when they go home at the end of the day, they have done something that impacts the quality of life for another human being, and they've helped them regain their life or regain their mobility or minimize their pain or whatever. And they know that they've done something useful, and so they like that. That gives them a lot of satisfaction. Another thing is that they don't have to go through a lot of extensive schooling. It's just a 2-year degree, so it's not that bad, and you can earn a pretty comfortable salary, which I'll get to in a moment. Another positive is that they tend to get a lot of respect from patients because the patients know that they are working with them and really trying to help them to learn to walk again or to stretch or to do whatever. And they know that they're there advocating for them and trying to help them. So patients and other healthcare professionals tend to have a lot of respect for them. So that's a good thing. And then finally, you don't have to document quite as much as you might have to in other healthcare professions. So that's another plus. What about the dislikes? Well, for one thing, you are limited in your scope of practice, and you do have to work under the care and direction of a physical therapist. So you're limited by a state of what you can do, and you're also limited to work under the supervision of a physical therapist. And some of them feel a little limited in that. They wish that they could do more. Another thing is that patients can sometimes be ill. They can sometimes be in pain. You may work with the elderly, and sometimes those patients can become rude, or they can maybe even become combative. So that is something you've got to watch out for in this profession as well, and they will dislike that. And sometimes it depends on where you work, but you may have to work with the elderly population. And some people you have to have a lot of patience sometimes when you do that, and some people just don't have the patience for it. Another thing is that it can be difficult to advance in your career. Sometimes you can go and you can do research and you can do other things, but a lot of times people feel they're kind of boxed in. It's kind of hard to advance, and you only have to have an associate's degree for a PTA, but if you want to do physical therapy, it's a pretty big leap in terms of education, because usually you have to have a master's degree, and then in the future they're going to try to roll it into a doctorate program. So there's quite a big gap for an advancement there, and that's one thing that they dislike. Now let's talk about some of the salary statistics so you can know how much money these individuals make. First of all these numbers that I'm going to pull come from the Bureau of Labor Statistics. That's the government agency that compiles and analyzes and records jobs data. So the good news is that there is a projected 41% growth rate for this profession between years 2012 and 2022. So there's definitely going to be a lot of demand and jobs opening up. Even so, some areas may have a little bit of a job shortage, but overall, it can be difficult to find a job, but overall, it's going to grow quite a bit. So that's a very fast growth rate compared to some of these other professions I've been covering. There are 76,910 PTA jobs approximately in the United States as of 2012. Now the rest of these statistics are 2014. So the average hourly wage, how much money they make, $26.12 was the average hourly wage. $54,330 was the average yearly salary. Now those are just averages, and that can vary dramatically depending on the state in which you live, the industry in which you work, whether you're entry level, which you'll probably be making less, or if you're at the end of your career, you'll probably be making more. So I want to talk a little bit about some of those factors right now to give you some perspective. First of all, what are the industries with the highest employment levels for PTAs? Number one, offices of other healthcare practitioners. The average salary there, $52,700. General medical and surgical hospitals came in at number two. $51,320 was the average there. And then nursing care facilities was the next one. $60,840 was the average salary there. What was the top paying industry for this profession? Home health care services came in at number one. $62,810 was the average. Employment services came in at number two, $62,040. And then nursing care facilities came in at number three. Again, the average was $60,840. Now let's talk about the states. What was the top paying state? Texas came in at number one, $69,370. California came in at number two, $64,850. And then New Jersey, number three, $61,630. Now the lowest paying states, number one, Hawaii, $34,570. South Dakota, number two at $34,760. And then Arizona at number three, $41,180. Now I will have an article on our website, registerednursern.com. If you're on our YouTube page, you can look down in the description. There should be a link. You can go to that article, and I have all 50 states and a little bit more detail with regard to some of these statistics. So you may want to check that out if you want more information. So that's a little bit about physical therapist assistants. It's a pretty interesting profession. Thank you so much for watching. Don't forget that we have other healthcare salary videos on our YouTube channel. So thank you so much and have a great day.